name is Candice Weaver, and I'm going to be talking about hernias, specifically a hernia. What a hernia is basically when a part of the intestine protrudes through a weakened part of the abdomen. That weakening can be congenital, which means that it was present at birth, or it can be from obesity, or having had multiple surgical procedures in the same area, or from poor wound healing that was due to poor nutrition or infection. What I found most interesting throughout my research was an allegory to help me better understand what this was. And basically, you can compare a hernia to a bulge in a damaged tire. The inner tube or soft tissue is normally contained by a hard upper rubber or the abdominal wall. And if there's a weak or thin spot, the inner tube can protrude through, which in your body that can be fat or intestines. And now I've never seen one of these in real life, but I did have a dog before, which I now know she didn't just have an outy belly button, which is what it looked like. It was a hernia. And I remember thinking, what if I just take a nickel down or something so that it wouldn't bulge out so much? Which I never did because it didn't cause her or us any problems. But if animal hernias are similar to human ones, I learned that you're not supposed to try to push it back in because then it can rupture and cause infection. Now you can go through my PowerPoint and learn more about it. So, as you can see, there are a select variety of hernias, which are all external. These are all pretty similar except for the inguinal hernia, being specifically the spermatic cord emerging out in men, and the round ligament of the uterus emerging out in women. In this slideshow, I will be talking about external hernias in general. So, what is a hernia and what causes it? The textbook describes an external hernia being the protrusion of a viscous through an abnormal opening or a weakened area in the wall of the cavity in which it is normally contained. Basically, that means a part of the intestine protrudes through a weakened part of the abdomen, and as you can read below, that weakening can be congenital, which means it was present at birth, or from severe pressure from coughing after abdominal surgery, which makes sense because if you're coughing, any of your insides have the opportunity to pop out in severe cases. Straining can also cause a hernia for the same reason, with too much pressure being in the abdomen. Also, wound infection and malnutrition can contribute to weakening of the abdominal wall. So what you might hear from patients is that they are experiencing pain depending on where their hernia is. They can have the urgency to defecate and a mass that they can see because everyone knows that a bulge like this isn't normal. You as a nurse can palpate the bulge and notice that it is soft and nodular, which means lump-like, and you'll obviously be able to visualize it. And so I put a note at the bottom saying never try to push the hernia back in because that can further complicate the situation by causing infection. Some complications. So a hernia can be reducible or irreducible. If the hernia is reducible, that means that it can be returned back to its original position by a professional, obviously. Don't try this at home by yourself. Or irreducible. If it is irreducible, it means that it is unable to be returned to the body cavity. This is considered the most dangerous because it can obstruct intestinal flow by being strangulated, which may contribute to the patient having the urgency to defecate. And what strangulated is when it occludes or cuts off blood supply and intestinal flow. If it is irreducible and it does get strangulated, then immediate surgery is needed. Some diagnostic tests that can be done are palpitation, and also a radiograph, like an x-ray, can be ordered to look inside and see what's going on. Medical management. So hernias that aren't bothering the patient pain-wise or by visibly being there, those can be left unrepaired unless strangulation or obstruction occurs. But an abdominal binder can help keep it from further protruding, and it will hold the abdominal contents in place. However, surgery can also be an option if it is an inconvenience to the patient or if there is a risk of strangulation. So one of the surgery options is herniorrhaphy. This is a laparoscopic procedure, and what this is it is a minimally invasive surgery inserting small tubes through the abdominal wall, and surgery takes place through those tubes, sometimes with the help of a robot. There is a lower rate of wound infection and quicker recovery compared to having an open surgery. What open abdominal surgery is an incision, where an incision is made directly over the hernia bulge, and a prosthetic mesh is sewn to strengthen the abdominal wall. And this can be an option for patients with a strangulated hernia. And these patients should be prepared for a longer hospitalization. And during this time, that can include having NG suctioning, so they can be educated on what that is. And they can also be given IV antibiotics, fluid and electrolyte replacement, and parenteral analgesics until peristalsis returns. Some nursing interventions. The nurse can observe the location and the size. With the size, they can measure it to see if it gets any bigger or smaller, and also observing the tissue perfusion. So if the blood supply does get cut off, it may turn cyanotic. The nurse can also listen for any abnormal bowel sounds. And on the post-operative side, the nurse can monitor for urinary retention, wound infection at the incision site, and scrotal edema with an inguinal hernia. Now, if scrotal edema does occur, it should be elevated on a rolled pad, and an ice pack can be applied. scrotal support, such as a jock strap or briefs, should also be provided. Also, postoperatively, we need to remind the patient to deep breathe every 2 hours. And I say deep breathe and not turn cough and deep breathe, because you want to instruct them not to cough if possible, because you don't want to add any pressure to the abdomen. But if they have to cough, we need to show them how to splint with a pillow or a pad. And also down at the bottom, there is administered analgesics for the pain. Some patient teaching. We can teach these patients to wear loose-fitting clothing, because you don't want to purposely hernia. We can teach them to avoid prolonged teething, lifting, or straining. Also for the same purpose, you don't want to add any pressure to the hernia. And these patients, you can tell them that if they experience any abdominal pain or distension, such as bloating, or they have a change in bowel habits, or if they start running a low grade or a high fever, or if they have any nausea or vomiting, that they should seek medical attention immediately. And they should also report any redness or erythema or edema or swelling of the surgical area or any drainage, as these things can mean infection. The prognosis of a hernia is good unless it is left untreated.